Let's start with the first station. So the first station will be my El Munzir. Any volunteer for the second station? Is there anyone who wants to do the second station? Let's just finish the first station. And if anyone wants, they
Okay.
can raise their hands to do the second station. But El Munzir, are you
Okay.
ready?
Yeah, ready?
So as you already know, this is a history taking station. You will have 6 minutes to talk with the patient and another 3 minutes to present your findings and answer any questions the examiners may have for you.
Okay, no mind.
Okay. I'll also give you 1 minute to read the prompt, even though the prompt is just a single line. Okay. We're starting with the first station. Your 1 minute starts now.
Okay. I
Just let
assume,
me know
sir,
when.
say me taking examination, yeah?
Sorry? No, no, this
Assume that me, yeah. Okay.
yeah, this is
Okay.
history taking mock, not examination.
Okay. No issue.
So just let me know when you're ready.
Okay, me ready now
Okay. So
to start.
start. Yeah.
Okay, first knocking the door, entering the examination room. Hello, I am Dr. Al-Munzir. This is my candidate number. Sensitization to my hand. And then towards the patient. Hello, I am Dr. Al-Munzir. I'm the surgical doctor here. Could I confirm your name and age, please?
Hello, I'm Tasin. I'm 50 years old.
Again, sorry, your name?
I am Tasin. I'm 50 years old.
Nice to meet you, Mr. Basil. Could you tell me what's your problem
Nice to
today?
meet you too. I came in because I've been having problems with my knee.
I am sorry for hearing that. This may be bothering you. Could you tell me what is your knee, right or left?
This is my right knee.
Sorry for that. When did it start?
It initially started a couple of years ago, but it's been getting worse for the last few months.
Couple months, yeah. Okay. How it started gradually or suddenly?
Initially, like started initially 20 years ago when and it has been increasing in severity over the last 4 months.
Okay. Sorry. Now you are right or need painkiller?
No, I'm doing okay. Thank you for asking.
Okay, great. You can proceed. Uh, can you describe this pain for me? What is its nature? Dull aching,
Uh,
throbbing.
I would say it's a dull aching pain.
Hmm. It move or go to other side or anywhere?
No, it doesn't go anywhere.
It is all time same or sometime decrease and decrease.
It sometimes increases after,
Hmm.
like at the end of the day, it increases, or if I walk for a long time.
I see. Sorry. Is anything make it increase?
If I work for a long time, it increases.
Anything make it decrease?
When I rest.
For rest. Okay, great. I want you to score this pain for me from 1 to 10 as 1 is least pain, 10 worst pain.
Uh, Usually it's a three, but sometimes, like at the end of the day, it can go up to a seven.
Sorry, I see that may be bothering you too much. Okay. Uh, Other, you have any stiffness in your knee?
No, I don't have any stiffness.
Okay. When you are walking, you notice your knee move away.
No, I don't notice that.
Do you when you walk, sometimes you feel your knee locked?
No, I don't feel that.
You hear any sound when you are walking within your knee?
No,
You have any temperature,
no,
night temperature?
no, not temperature.
You have history of trauma before?
Yeah, I did injure this knee 20 years ago. I had
Mm,
surgery for it
what,
as
what,
well.
what, you what though? Again?
I injured this knee 20 years ago. I had surgery for it
hmm
back then.
Okay, sorry for that. Uh, you have any back pain?
No, I don't have any back pain.
You have any pain other in your body for chest pain, tummy pain?
No,
There is any skin changes around the knee?
no, no skin changes.
Great. Uh, Other, you have before, you told me before 20 years, you have injury, your knee. You have other condition?
No, I have no other conditions.
You go regularly for your general practitioner for any medical condition?
No, I don't.
You have a family history of similar condition?
No, I do not.
I want to ask, you have used any medication now?
I just use paracetamol and sometimes codeine.
Mm, that okay now?
That does help, but it's been getting worse. So I'm a bit concerned.
Sorry. Okay. You have any allergic?
No, I don't have any allergies.
I want to ask you some question, maybe personal.
Yeah, sure.
What is your job?
I used to be a rugby player.
What? Again, not clear.
I used to be a rugby player.
Rugby. Okay, nice. I think that nice job. Other, but you are a smoker. Did you smoke?
No,
Did you drink alcohol?
no.
Okay. You have any concern of any idea you want to tell me?
I feel like this pain is something related to the surgery I had 20 years ago.
Okay, I understand your concern. I'm now going to discuss, even I will discuss your condition with my consultant. Uh, I will inform you if it's related to your previous trauma or maybe other thing. Is that okay?
Yeah, that's okay. 6 minutes are up. So give me a
Okay, thank
summary
you.
of the patient's condition.
Okay, 50 years old male, rugby player, present by right knee pain that for for last 2 years and increase the last 2 months. Is dull. It's aching pain. It is worse at the end of the day. Increase by moving and decrease by painkiller and analgesia. No skin change, no swelling. Other systemic review, past medical history are clear. My professional diagnosis maybe have right knee osteoarthritis. I put my mind other differential diagnosis maybe have rheumatoid arthritis, meniscal injury, ligamentum injury, yeah, septic arthritis.
Uh, what single investigation would you recommend?
Single investigation.
Yeah,
I can do file needle. I will do aspiration cytology from the knee.
so the single investigation you choose to do is aspiration cytology.
Yeah, aspiration, yeah, from the swelling. If there is
Okay,
swelling in the knee, can take aspiration cytology.
okay.
If I have another option, I can request a lateral and anterior posterior X-ray for the knee.
Okay. If you have to choose between those two, which one would you choose?
Okay, if I start, I will start by X-ray.
Separate. And what would you expect to see on the X-ray?
In X-ray, I she is want to see if there is any uh, a hidden fracture or if any abnormality within the joint, within any joint,
Like what do you mean by
like little
abnormality in
lesions
the joint? What are you
in
looking for?
case like yeah, if there is a little lesion like in uric abnormality in patient that coming is is a uric acid like gout disease or
You want to see gout on an X-ray.
what?
You want to see gout on an X-ray.
No, I should
Uh,
say it's the lytic lesion that happened by
Okay.
in gout derivation. Lytic
Okay.
lesion.
Okay. And how would you treat him?
Again,
How would you treat this patient?
according to his condition, first you start by conservative management. I start by inducing exercise that is strengthening joint. Uh, other making patient rest, elevation, uh, hot backing for the knee, and physiotherapy. Then going to our medical therapy can prescribe for him non-steroid anti-inflammatory medication, other intra-articular steroid. Then we can do for last option, we have a surgical option. We can do for him if there is a septic ulceritis, we can do uh, arthrocentesis. Uh, Arthrocentesis, we can do him realignment surgery or even total or partial knee replacement or arthro disease
So,
or arthroscopy. Or even we have option of arthroscopy.
what are the causes of failure of total knee replacement?
Okay, maybe a septic failure, or maybe there is an infection, or maybe there is a fracture, or maybe it is fracture or
Thumbs up. Let me start off with saying you did a great job, Tomo. Your
thank
history
you.
taking was really good. You touched upon all the basic points that's required for a normal history taking station. So let's get on with the history taking part, then we'll move on to the questions. Okay?
Okay,
Yeah.
thank you.
Yeah, this patient came with knee pain, and you started off with the
Mm.
introduction. Great. You asked for the name, you asked for the age, confirmed the patient details. Perfect. Then you asked about how to help you, and I told you about my knee pain, and you wanted to know more. Good. Then you went on to Socrates. Perfect. And you excluded the other differentials like rheumatoid arthritis, meniscal injury. You asked about swelling. You asked about skin changes. You asked about spine pathologies. All good. All good. Red flag symptoms. You asked me about fever. Yes. It would be better if you can ask me about weight loss or tiredness, because cancer symptoms do tend to come with weight loss. So these red flag symptoms that you see here, the red flag questions, you can ask them in almost all stations. No matter what the presenting complaint is, you can ask them everywhere. And another thing I would like to mention is when you're asking the closed questions, like when you see the prompt, for example, this is patient with a knee pain, patient with knee pain. Keep at least 5 differentials in your mind and ask a single question from every differential. You did that, so, which is very good. You asked about past medical history, medication, allergies, family history, all good. Travel in this particular scenario, travel is not that important. If I asked if the patient had back pain and the patient, or yeah, if the patient had back pain, then I would recommend you ask about travel, back pain, fever. Occupation, good, you asked about that. Social, mm, again, this is not that important in this scenario, so that's okay. Alcohol, you asked about smoking as well. Two things that you could have asked, which are important in this scenario, is diet and exercise. Okay, moving on, ideas, concerns, and expectations. You asked about ideas. Good. You added concern with it. That's okay. That's fine. One thing that you missed was the expectation. Why is the patient coming to you? Does he want medication? Does he want surgery? Does he want scans? You're not gonna know what the patient wants unless you ask him. And these three questions are very important. These three questions, they're gonna come as professionalism marks. So, as I mentioned before, you see the prompt, you have five differentials in your mind: traumatic, infection, inflammatory spine, and extraintestinal. Just ask a single question from everyone. Traumatic, did you injure yourself? Infection, do you have a fever? Inflammatory, do you have a swelling? Spine pathology, back pain, intestinal skin changes. You asked all of these. Very good. So the way and let's come to the presentation. Yeah, this is a 50-year-old gentleman who came to the clinic with pain in his right knee. Good. This started 20 years ago, not 2 years. You mentioned 2 years. And severity over 4 months. That is okay. Dull ache, good. Increases at the end of the day. You mentioned that. And radiation, you also mentioned. Uh, you did not mention the severity and the pain is limiting his daily routine. You could have asked how this is affecting the patient, because that is going to be very important in determining the treatment you're going to offer the patient. Also, you did not mention that the patient had a past history of knee trauma and surgery, which is also very important in determining the treatment modality of the patient. You said that your main diagnosis was osteoarthritis, and your differentials were okay as well. So, afterwards, I asked you the single most important investigation, or the single investigation that I would recommend, that you would recommend. You started off with saying aspiration in cytology, thinking of septic arthritis. You said yourself that your main differential was osteoarthritis. So if your main differential is osteoarthritis, stick with the main differential and go along with it. This patient did not have signs of septic arthritis. He did not have a swelling. He did not have fever. So you said osteoarthritis, correct? Then the next one would be knee X-ray. I had to prompt you a bit to get that answer. So you lost a lot of time there. You actually took 4 minutes. Like I gave you 4 minutes to answer all the questions, but in the exam you're gonna have 3 minutes. I just wanted you to go through all the questions so that you have an idea of how it's gonna be in the exam. Okay. So if this patient is suffering from osteoarthritis, what would we see on the X-ray? There's four features of osteoarthritis that we see on an X-ray: joint space narrowing, osteophytes, subchondral sclerosis, and subchondral cysts. This question will also be in your theoretical part of the MRCS pathway. They're gonna ask you about the features of osteoarthritis, where you have to say these four things. Next question, treatment. Treatment, you answered correctly. You answered about regular exercise, strengthening the muscles, heat application, physiotherapy, steroids, medically anesthetic PPI, and maintain or achieve a healthy weight. That's why I wanted you to ask about diet in this patient, because if the patient is already eating healthy, you don't have to talk about healthy weight. If the patient is overweight or eats a lot of junk food, then you tell the patient, oh, you need to reduce your fatty intake. You need to eat more healthy. Next off is surgical. You talked about arthroscopy, arthrocentesis, realignment, and total partial knee replacement. All okay, all good. And the last question, causes of failure of total knee replacement: infection, fracture, wear and tear, and aseptic loosening. You spoke about infection, you spoke about a fracture. You could have spoken about aseptic loosening, but that's okay. Just remember that at least three. So all in all, your history taking was good, but when it came to the question part, you got a bit lost. Management causes all were good, but you took a bit more time in this area, the single investigation, and how what to expect. If you do not know the answer, just say pass, and we can move on to the next question. The examiner is not going to prompt you as much as I did. Do you have anything to share, El Manzir?
No, no, thank you. I think this is most informative point and helpful for me.